Chair is pleased to recognize the gentlewoman from Washington State, Dr. Schrier, to question for 5 minutes.
Thank you, Madam Chair, and thank you, Secretary Becerra, for coming before this committee today to talk about the HHS budget and priorities. First, let me just say, as a pediatrician, I want to thank you for prioritizing children in your budget in so many ways. One thing I'm especially pleased to see is the expansion of the Vaccines for Children program to cover CHIP enrollees. And this aligns with the provisions in the bipartisan bill that I sponsored with Dr. Joyce, Representative Butterfield, and Representative McKinley that strengthens this already excellent and really important program. I was also really happy to see the proposal to improve access for more children by expanding the network of providers who participate in the Vaccines for Children program. And this is really important. We're seeing a drop in routine childhood immunization rates because of COVID. Just last week, it was reported that hundreds of thousands of students are no longer adequately protected from common diseases, used to be common diseases like measles, mumps, and pertussis. And this is particularly dangerous for the tweens in middle school who are particularly behind on their vaccines, where we already see outbreaks of whooping cough. On the topic of immunizations, again, as a pediatrician mom, I know that the best way to help anxious parents feel comfortable about vaccinating their children is a conversation with an empathetic, compassionate, trusted provider. I also know from experience that these conversations take time and that trust is not built overnight. The Medicaid program acknowledged this last summer and is now recognizing the considerable time and effort this can take in a clinic visit and implementing programs to make sure that every person who wants a vaccine can get it. Secretary Becerra, how will HHS work with CDC to ensure that children get caught up on routine childhood vaccinations? And how can we make sure that the pediatricians can take adequate time to have these thoughtful conversations?
Congresswoman, first, you have really pointed out how important it is that those trusted voices that get Americans to take the leap are so essential in this effort. And pediatricians are among the most trusted individuals when it comes to encouraging families to take important measures, safety measures for their children. So we're going to be working with those trusted voices, including folks like you and others, pediatricians, who can really reach out and connect with families in ways that others can't. We're going to continue to make every effort to provide states and local governments with the capacity to do more screening of our families so that they can get the type of information they need. So if we find out they haven't yet received a vaccination, that those families will take the step to let those children be vaccinated. And we're going to try to do everything we can to make sure that under the health programs that the federal government helps administer, Medicare, Medicaid in case of children, and CHIP are available to help those families who have lower incomes be able to include their kids when it comes to the protections that a vaccine provides.
I appreciate that, and I appreciate having multiple locations where kids can get those vaccinations. It also may make sense because those conversations are so long and can take away from other important conversations we have with patients to even have the ability to do a separate visit just regarding vaccines. I also want to highlight your comments about ensuring that Americans have access to affordable health care. And with the help of the American Rescue Plan, there was a dramatic drop in insurance premiums last year. In fact, in my state, nearly 60,000 Washingtonians enrolled in new coverage, and more than 100,000 Washingtonians pay $100 or less every month thanks to these subsidies. And I just want to emphasize how important it is to keep those cost-cutting subsidies and to not let them expire at the end of the year, and also, of course, to expand Medicaid in states that opted out. Is there anything, Secretary Becerra, that Congress can do to work with you to keep healthcare affordable for Americans with the Affordable Care Act plans?
Congressman, I think you mentioned one of the most important things that you can do, and that is to continue those subsidies that have made quality healthcare. These are robust plans. They're not those skinny junk plans, insurance plans that some people have to buy because they only pay a small amount upfront in premiums, but when they actually end up using the healthcare services, they pay a ton of money out of pocket. And so these plans, as you mentioned, $100 a month in premiums for some families, under $10 a month for other families. It's the way to go. With your help, we can make it possible for more families.
Gentlewoman's time has expired.